Here is a scan of the room. The patient, as well as the ceiling, and then all of my tools. And my name is Courtney Millington. My name is Courtney Millington. This is my head to toe assessment video for the F&P program at the University of Memphis. And it is January 17th, 2022. I'm first going to start. I've already washed my hands. This is Charlie by just inspecting his skin. So I'm looking at color, which is consistent with ethnicity. The temperature is warm and dry to touch. Skin turgor is elastic. The texture, I'm looking for any lesions, scars, bruising, nevi, masses, any redness and swelling. I'm looking at his head, his face, neck, his posterior chest, anterior chest, and abdomen. His head is normocephalic and midline position, palpating for any tenderness on your scalp. His hair is brown, coarse, and evenly distributed. I felt no masses. I see no indentations, no infestations, no lesions. Then going to palpate and see if there's any tenderness in his temporal arteries. Do you feel any tenderness?
No.
And then palpating the lymph nodes, so pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior clavicle, posterior clavicle, and supraclavicular. And then if you could clench your jaw for me, looking at TMJ for any crepitus, subluxation or tenderness, which I felt none. Cranial nerve number 5, trigeminal, having the patient open and shut his mouth. Good, and then close your eyes for light touch sensation and tell me where I touch on your face.
Forehead, nose, chin, cheek.
Good. And then cranial nerve number 7 for facial symmetry. So smile with your teeth, frown, raise your eyebrows, puff out your cheeks, pucker your lips, and raise your eyebrows. Good. And then I'm going to move on to his ears. I'm looking at the position. I'm looking at their placement and their shape, palpating the pinna and the tragus. I feel no tenderness or masses. Going to inspect the tympanic membrane and the auditory canal bilaterally. Tympanic membrane is visible, pearly gray with a cone of light, and I see no redness in the auditory canals. And I am then going to do cranial nerve number 8 with the Weber test, the Rhine test, and the whisper rectalis. So just tell me what I whisper, close this ear.
1, 2, 3.
And then on this side, just tell me what I whisper.
Apple.
Good. I'm then going to strike this and place it at the top of your head and just let me know if you hear it equal bilaterally or on one side greater than the other.
Equal.
Good. And then I'm going to strike it again and place it on your mastoid bone and then next to your ear, so just let me know when the sound stops both ways.
Now. 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 Now.
Good. So air conduction is greater than bone conduction. I'm then moving to his eyes, looking at his eyelashes, his eyebrows, palpebral fissures. I'm going to look at his conjunctiva, which are moist and pink. His sclera are white. I see no lesions, no discharge, no redness. His eyes are blue. I'm going to test cranial nerve number 2, objects, which is gross visual acuity, as well as peripheral and central vision. So just with the Snellen chart, standing 6 feet back. If you could close your left eye and read the smallest line for me.
EPTZO.
And then close your right eye and read the smallest line for me.
EPTZO.
Great. So he has 20/30 vision in both left and right eye. And then if you could just tell me when you see my fingers.
Now.
Good. And then cranial nerve number 3, which is ocular motor. I'm going to test for direct and consensual pupillary response to light. So just look straight ahead. Good. Very good. I'm going to test for accommodation and convergence. So just follow my finger into your nose while looking straight ahead and back out. Good. And then cranial nerve 3, 4, and 6, ocular motor, trochlear, and abducens with EOM. So just, again, keep your head straight and follow my finger. Good. And then I'm looking at all other internal eye structures as well as the red light. Very good. And then moving to his nose, which is midline position and straight. I'm going to test cranial nerve number 1, olfactory, making sure since the smell is intact. So close your eyes and just tell me what you smell.
Coffee.
And then I'm going to get you to close one nostril and sniff, and close the other one and sniff. Nares are patent, and then palpating the maxillary and frontal sinuses. Do you have any tenderness there?
No.
Perfect. Then moving to his mouth, I'm looking at his lips first of all, and then if you could open your mouth, I'm looking at his teeth, his gums, his buccal mucosa, his tongue. Lift up your tongue, the floor of his mouth, underneath his tongue, his posterior pharynx, salivary ducts, as well as tonsils and grading them, but he does not have tonsils. I'm then going to test cranial nerve 9 and 10, which is vagus and glossopharyngeal, by just having the patient open and say, ah. And his soft palate and uvula rises symmetrically with phonation, as well as cranial nerve number 12, hypoglossal, if you could stick out your tongue. And tongue is midline without fasciculations. Good. I'm then going to his neck. Going to palpate his trachea, and it is midline, and then I'm going to just have you swallow to palpate the thyroid gland. Good. And then palpating the carotid arteries on both sides, which are A2+, as well as listening with a bell for any bruise. Good. I'm then going to move on to his posterior chest. So I'm going to turn and scoot up just a little. Okay. First, looking at his posterior chest, I see no deformities. It's symmetric. I'm going to get you to breathe in and out to test for symmetric chest expansion. I see no signs of respiratory distress. No use of accessory muscles, tripod positioning, cyanosis, tachypnea, retractions, anything like that. I'm going to test for tactile firmatitis. So just say 99 when you feel my hand.
99, 99, 99, 99, 99, 99.
Turn on. And then I'm also going to percuss in the intercostal spaces. And auscultate. Just take deep breaths when you feel my stethoscope. And making sure I get the lateral sides. And next I'm going to test for ergophony, just having you say E when you feel my stethoscope.
E, 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 E.
And bronchophony, just say 99 when you feel it.
99, 99, 99, 99, 99, 99.
And then if you could whisper 1, 2, 3 when you feel it. Very good. And then I'm going to then move to your anterior chest. And again, I'm looking for any deformities, checking to see if the chest is symmetric. I don't see any signs again of respiratory distress, no use of accessory muscles, tripod positioning, nasal flaring, cyanosis, tachypnea, retractions. I'm also going to test for chest expansion to be symmetric here, breathing in and out. Good. And then test for tactile firmatitis here as well. So just saying 99.
99, 99, 99, 99, 99, 99.
And auscultating as well. Just some deep breaths. Very good. I'm then going to auscultate the heart sounds with the bell, the stethoscope, and then the diaphragm. So aortic, pulmonic, Erb's point, tricuspid, and mitral. And at mitral, I'm listening for the PMI for a full 60 seconds to get his rate. Then also going to listen with the diaphragm, aortic, pulmonic, Erb's point, tricuspid, and mitral. Very good. I'm then going to let the patient lay down with his head at a 30 to 45 degree angle. And I'm first looking for any JVD or jugular pulsations. I don't see any of that. I see no heaves, no lifts, palpating for thrills in all of the aortic, pulmonic, Erb's point, tricuspid, and mitral. And I feel no thrills, as well as auscultating with the bell and diaphragm again. In the aortic, pulmonic, Erb's point, tricuspid, and mitral. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Then moving to his abdomen, scoot up a little now. Yeah. And first it is round, it is flat. I see no obvious signs of deformities or masses anywhere. I'm going to first auscultate with the bell and to listen to his aortic, renal, iliac, and femoral arteries. Good. I'm then going to auscultate all 4 quadrants as well with the diaphragm. And all vowel sounds are normoactive as well as percuss for any Tiffany or dullness. And palpating for any tenderness. Do you have any tenderness?
No.
And palpating his liver and spleen. Good. And then I'm going to have you sit up, but still kind of turn to the side a little. And just testing for CVA tenderness. Tell me if you have any pain. Any pain that way?
No.
Perfect. And then face forward. I'm now going to look at the joints of his hands and his wrists, elbows, and shoulders for any crepitus, redness, swelling, no pain, no tenderness. I'm going to test his radial pulses and his capillary refill. And then if you could grab my fingers, so 5 out of 5 strength in his hand grip. And then his shoulder girdle, if you could shrug up against my resistance. Good. And then cranial nerve number 11 as well, accessory. And testing the strength of his biceps and triceps. So first, push against my resistance, and then pull against my resistance, which is a 5 out of 5 strength there. And then your shoulders, so pushing your shoulders out, which is abduction, and then in, which is adduction. Very good. And so next I'm going to do range of motion in his fingers. So hold your fingers out with flexion, extension, abduction, out, adduction, in, and then put your thumbs together, and then your wrist, which is going to be flexion, extension, and then radial and ulnar deviation and rotation, and then your elbows, which is just going to be flexion and extension with no hyperextension here, and then your shoulders, which is going to be flexion, extension, internal rotation, external rotation, and then abduction away from the body and adduction into the body. Very good. Then going to do light touch sensation on both upper and lower extremities. So just close your eyes and tell me where I touch.
Arm, arm, hand, hand, leg, leg.
Very good. And then I'm going to do his cerebellar coordination. So putting your hands on your knees and just quickly flipping your hands over. Serial fingers, so just tipping the fingers. Good. And then putting your fingers together. Very good. And then stereogenesis and graph. So if you could close your eyes and just tell me what you feel in your hands.
Tweezers.
Yep. And then tell me what I write on your hand. Just a letter.
X.
Good. Okay, then I'm going to move to his lower extremities and doing the deep tendon reflexes. So your brachioradialis. And then your biceps and triceps. Good, and patellar. And Babinski. Very good. And then I'm going to test the capillary refill in his toes, which is less than 3 seconds. And then the dorsalis pedis pulses and posterior tibial pulses. Good. And I'm also just feeling the joints in his feet and his ankles, knees, and hips. I feel no crepitus, no redness, no swelling there. And then in your feet, range of motion, we're going to start with his toes. So we're going to do flexion and extension, and then abduction away and adduction in. Good. And then with your ankle, so flexion and extension, external and internal rotation, inversion and eversion. Good. And then I'm going to get you to push up to test your strength, and then down and +5 strength there. And then can you flex or push out on my hands, and then pull in for 5 out of 5 strength in his lower extremities. Then I'm going to let you stand up and do range of motion of his knees, so flexion and extension with no hyperextension there, and then range of motion of your hips. So we're first going to do abduction away from the body, both sides. Adduction across the body, both sides. Good. And then rotation, external and internal. Very good. And then we're going to face this way, and I'm going to get him to bend over, looking at his spine, which I see no scoliosis. I see no deformities. It is straight with normal curvature. I'm gonna let you stand up, and we're gonna test range of motion. So just flexion, extension, and then lateral rotation. Good. And then as well as your cervical spine. So flexion, extension, lateral rotation, and around as well. Good. And then I'm going to get you to walk forward with one foot in front of the other for tandem walking. Perfect. And then walk back that same way. Very good. And then Romberg, just standing with your eyes closed and your hands beside yourself to not lose balance. Very good. And then if you could hop on one foot with your eyes back open. Perfect. And that is all for my head to toe assessment. Thanks.